So,
Yay! Thank you so much for joining me today. Well, tonight for you in our
thank
live
you.
stream.
Good
It's
evening.
10 p.m. there.
We have 10 p.m. Yes, it's evening.
So you're in Luxembourg. So I keep forgetting how much of a time difference it is between New York and the rest of Europe. Because the last time I've been to Europe was, I think, in London way back in 2006. And that's my biggest goal to go back after everything is open again. But I think things are slowly opening up. Anyways, how are you, Dr. Cigdem?
Thank you. I'm fine. How are you doing in New York? So I just saw in news and it's
Yeah,
super
I know.
faster.
So
It's
many
not
things.
so easy right
Yeah, so
now.
many things are going on here. Well, I think just a few days ago there was like a big storm. I think it was caused by a hurricane that was like facing down south, and a big part of the city was like flooded, but fortunately for us we weren't affected. But yeah, but I'm so excited that we're here. I know we had to find that perfect day and perfect time for us to be here because I didn't want you to stay up too late as well. But anyways, Dr. Cheetham, can you please introduce yourself to everybody who's watching today?
Yes, for sure. I'm working in Luxembourg, very small city, small country in Europe. I'm psychiatrist and psychotherapist. And yes, I can explain a little bit about my medical journey if you want.
Yes,
So
please.
I was working in Germany for many years before I came to Luxembourg. So I'm in Luxembourg since 2.5 years. And I started my medical journey actually in Turkey. I went
Mm.
medical school in Turkey for 6 years. It's almost same everywhere in
Yeah,
Europe.
yeah.
And after 6 years, so for my residency training, I came to Germany, but I couldn't speak German, so I learned German first.
Wow.
And made all the exams for the medical
Mhm,
license. And then
mhm,
I did my residency training for 5 years in the psychiatry and psychotherapy. So
mhm,
it's a little bit different. I think here we are doing also the psychotherapy together with
mhm.
the psychiatry.
Yeah.
So after this, I worked also in the neurology for 5 years and in some clinics in Germany in the psychiatry. And I decided to stay in the psychiatry, and I have now my own clinic in Luxembourg.
It's amazing. Such a long and expansive journey, right? Like, especially like medical journey in general, like even here, like medical school and then the residency and all of your training. One thing I always like asking my guests is, given the long time, and obviously that time, like you make a lot of sacrifices, right? Sacrifices of time, sacrifices of money, sacrifices of, oh, I can't go to this birthday party because I have to study or I have school. Now that you've gone through all of that, do you have any regrets given the amount of time that you have spent to get to where you are now?
I don't think so. That no, I don't regret it because I was always wishing to be a psychiatrist since I'm
Mm,
close.
wow.
I wanted to be always in medicine, and I know for many colleagues they say, "Oh, I want to be something else," but I
Mm,
like to be a doctor or as a
yeah,
psychiatrist working as a
yeah,
psychiatrist. So I don't regret it, and probably it's a little bit more expensive to study in states as here because I mean here in Germany or in Turkey, so it
sure.
was so
Yeah.
expensive to study. I think it was okay.
Yeah, I think that's one of the biggest differences in the medical training here and there is how expensive it is here. Like for those who don't know, I think an average of about $300,000 is the amount of debt medical students come out of after medical school, which is such amount of money. You said you've always wanted to be a psychiatrist since you were 12, and I'm very curious about that. What are your inspirations into joining this field? Was there a family member who was a psychiatrist, or a friend, or a personal experience?
And my uncle was psychiatrist, but he
Mm.
always said to me, "Don't be a psychiatrist. You won't earn any money, so it's better to do something else." But I mean, I was loving the psychology, and I thought that with the medicine and psychology, I can. There's a good combination with psychiatry. So,
Mhm,
and I think I wanted to be first a doctor and doing
mhm,
the journey
mhm.
through psychiatry with the psychology, and
Yeah.
it's a combination, the good combination that I think it's good ideal for me at least.
Yeah, yeah. If there is a medical student or pre-medical student who's watching our live, coming from a doctor, first and foremost, what is the biggest advice or the number one advice that you would give to a student who's aspiring to become a doctor?
Advice for being a doctor. I mean, I advise for, so it's a long journey for sure, but it's worth it. I don't regret it. And I think always important to following the path, not something else. And it's always important to remember what are your goals, even it's too hard sometimes.
Yeah, I agree. And I wanted to talk about psychiatry because, like you said, it's kind of like a dual, I guess, there in Luxembourg or in Europe, psychiatry and psychotherapy. So it's a dual residency training then?
Yes, I mean, for example, I just checked today, it was before 1992, so it was only psychiatric residency. So they changed and they integrated the psychotherapy. So it's normally beside your psychiatry training, you have to have also training in the psychotherapy in the same time. So it was a lot of work. So my every weekend was full of the seminars and trainings and supervision. So it's normally 5 years training, 4 years psychiatry, psychotherapy, and 1 year neurology. But it takes a little bit longer normally, but you have at least 4 years in the psychiatry. Then you are also psychiatrist and psychotherapist. So we are always doing also psychotherapy because it's also the difference that will be paid from the insurance here. Okay, the patients must wait for the appointment, but at least they don't need to pay this extra. So this is a big difference, I think, also from the States, so they can get better help then.
The United States has a lot to learn and change in the whole system.
Country, so it's
I know. How would you define the difference between psychiatry and psychotherapy? How are they different from each other?
I don't think that there is a big difference, but maybe I think in the psychiatry we are just making a combination from social psychiatry, biological psychiatry, and the psychotherapy. So this is a combination from all, and I don't think that we can separate each other one from the other ones. We need to also see the patients from all. I think when someone comes, so there is a social part that we need to be aware of, and there's a biological change. This kind of chemical disbalance in brain. So, and there is also kind of conflict in the psychotherapy that we need to focus on.
Let's say you have your own practice, right? What do you think is the bread and butter of psychiatry? Like, you're gonna work today and you'll be like, for sure, I'm gonna see this, or this in the patient. What are the most common reasons why people would come to see you?
So most of the reason, I think, the anxiety disorder. So especially during the pandemic, was a population from the anxiety patients and depression. This is then we just look for the even your survey. So surprised to see today is more than 80%. They are just suffering anxiety problems, or they just suffered in the past. A huge number. I checked the statistics. Maybe I can just say to you. So, in Europe, so it's a little bit maybe. I think in US it's more, but in Europe, in each year, 25% of the population suffering from depression and anxiety. So 25% is a huge number. So it's from your friends, every fourth person has this problem every year, but about 50% of measured depression, they are not getting any treatment. So it's actually sad because many people they don't go to doctors or any psycho for getting treatment.
I mean, we were talking about this earlier. I really feel like a big part of it, well, based on the stats that from the survey that I took, it's really the pandemic. Where do you think this is rooting from, Doc? Is it from because when the lockdowns happened, people were isolated or people are afraid to get sick? You think it's a mixture of like fear and paranoia, I guess?
I don't think that it's a kind of paranoia. I think it's normal to have fears also. It was something unknown at the beginning. For example, so we didn't know, and we kind of virus, we didn't have any.
We didn't know anything,
So this was a kind of fear that the people, and it's normal to have fears, the kind of protection for us. But after some time, so for sure, some people have more anxiety as the other people.
Yeah.
And in Europe, we had 3 lockdowns, and
Oh, yeah.
we needed to stay at home, and it was good at the time. And I think after the vaccination, the people get more relaxed and
Yeah.
now enjoying more life. But this 1 year, it was a difficult
Yeah.
year for many people, especially for the healthcare workers.
Yeah.
I had many patients from the healthcare workers and many teachers. So, because, for example, in Luxembourg, the schools were open, so they just made some tests, but they were open. So, and it was a kind of risk every day.
Yeah. Yeah. What does that chronic feeling of fear and stress induce in the body, Dr. Shidam? Like, what does that do, I guess, both biologically, like in the body, and how does that take a toll on someone's vulnerability to becoming more anxious? I think what I'm trying to ask is there a difference between, oh, I'm anxious, and, oh, I have an anxiety disorder? Oh, I feel depressed. Oh, I have clinical depression. Is there a difference between the two? Is everyone just clinically depressed or clinically anxious?
So we have some diagnostic, so there must be some symptoms, and as you know, there are some diagnostic criterion for it. So it means not everyone, when you are sad, it doesn't mean you are in depression.
Yeah.
Or when you have fears because of the infection, or you get anxious for a short time because you have an exam or something else,
Yeah.
it doesn't mean you have anxiety. But if it happens every day, if it's affecting your life, if it's affecting your functioning, if it's affecting your lifestyle, so working, so then we can talk about anxiety and depression problems.
Yeah.
There are some grades, so not everyone has the same level. There is a moderate depression, there is a severe depression. For example, for the minor symptoms, then we don't recommend to take medication. So it's some with the light symptoms, it's not always recommended.
Yeah. Talking about actual diagnosed clinical depression and anxiety disorders, what I remember from school way back in my psychiatry rotation was what they call the diathesis stress model, which is basically the proposition is that the emergence of a mental health disorder or psychological disorder is a mixture of genetics where some people are just genetically vulnerable to having psychiatric disease. And then if there's environmental stressor, whether it's mental, physical, or emotional, then the actual psychiatric condition comes out. What do you think is the cause of a diagnosed and psychiatric disorder? Is it genetics? Is it environmental? Is it a mix of both?
Yes, it's a mix of both. So, I mean, the model that we see right now is a kind of biosocial effect.
Yeah.
The genetic disposition for sure, but also the people when they just, it's not only genetic, when they just grow up with the parents and some, for example, parent, mother or father, when they have anxiety, they see some parents and they just take it subconsciously. And there's for sure a genetic part too. And after some time, and if there is a stress situation, traumatic event, or something else, it can trigger the symptom. But it doesn't mean that everyone, for example, if someone has depression in the family, it doesn't mean this person will get depressed also in the future. So, but for sure, there are some connections.
Yeah. It's very interesting, right? Because there's some people who have gone through so many heartbreaking things in their life, but after that, they're okay, right? But there are those who go through, obviously all pains are valid, but heartbreaking situations, and then they come out and they are depressed. I agree with you that it's a very complex mixture of both, right? You can't just say, oh, this person won't get anxiety, this person won't get depressed. And I wanted to segue that into, because I grew up in a very conservative and religious background and family. And these topics can be taboo, right? And I think also in different cultures, anxiety, depression, or phobia, you'll hear things like, oh, it's just in the brain. Oh, mind over matter. Oh, just pray it away. As a psychiatrist and an expert in the field of all the psychiatric disorders, how do you target those statements?
As you said, I mean, there are some people, they are in difficulties, and for example, they are leaving the war, and
Yeah.
they still stable. So
Mhm.
it depends on also how you cope with the problems, how you cope with
Mhm.
the situation, how you learn it. And
Mhm.
for sure, we don't see every traumatic event is the always, it doesn't mean that you're getting a post-traumatic disorder when
Mhm.
you have a traumatic event.
Mhm.
So sometimes we learn also from our problems, or psychology is strong enough to learn some coping strategies.
Mhm.
But sometimes it's also important to get some help if we
Yeah.
cannot do it by ourselves.
Yeah.
But it doesn't mean you should go directly to a psychiatrist, but at least
Yeah.
talking with a friend or
Yeah.
talking,
Yeah.
just seeking help and not trying to manage everything by
Yeah.
yourself. So this
Yeah.
is the first step, just saying, okay, I cannot manage it right now, so I'm just seeking help. Talking with a friend or a
Yeah.
teacher, or I go to psychologist or psychiatrist. So
Yeah.
there are many ways to seek for help.
Yeah. Someone comes up to you, to your clinic to see you and says, I'm very anxious or I've been struggling with anxiety. Do you have a stepwise approach to taking care of that person? I'm asking because there's a big misconception here in the United States, at least from what I know, is a lot of people don't want to go to psychiatrists because they feel like once they see them, the first answer is always medications. How do you maneuver that? How do you take care of your patients who come in and say, Doc, I have a problem and I need help? Is it medications right away?
I think you need to first find out if there is an indication for medication.
Mm.
So, because not everyone needs medication. So, if you don't have any like moderate or severe depression,
Mhm.
we are not talking about medication. So, when someone comes and saying, okay, I'm anxious, and we try to first find out what's the problem, what's going on, what are the trigger, which kind of
Mhm.
conflict, so what's in the background, why
Yeah.
it's because this person is coming with a symptom, so
Yeah.
there's an issue, but
Yeah.
why it's happening, so it can be anxiety, it can be sleep disorder, or
Mm.
it can be alcohol problem, but what's happening in the background, so
Mhm.
why it's happening is
Mhm.
important to find out the conflict, then you can solve it, you can help this person. If you just concentrate yourself to the symptom and trying to
Mhm.
solve the symptom only with the medication. For example, when someone comes and wants to saying, I cannot sleep, I have a sleep
Mhm.
problem, so you can just write a sleep medication for sure. But
Mhm.
it's important to find out why it's happening. And
Mhm.
I agree with you. Many people don't go to psychiatrists because they think, I'm going to get medication. But if you need it, I would say for sure. So if
Yeah.
I see there is a need of medication, I will
Mhm.
talk about it. But there are also some plant-based medication that we
Mhm.
use in the psychiatry. And the problem for many people, they think when they take medication, the personality will change. But then I'm asking, is it your personality to have anxiety all the time? So is it your personality? Do you accept as normal personality?
I agree. I agree with that. See, that's a great psychiatrist right there because, and I think generally, like a great doctor, right? Or someone who sees patients is someone who focuses on the person and not the symptoms itself, right? I think we get so hung up on all the numbers, all of the symptoms that we forget that the person coming in has a story to tell, right? That there's something underlying going. Obviously, not to give out specific patient details, but for your patients who come in with for anxiety and depression, do you see a trend of what's causing theirs, like situational wise? Is it separation from loved ones? Is it a death of loved ones? Is it divorce? Is it sickness?
I think it can change
Mm,
from place to place.
mm,
There's kind of cultural
mm,
aspects.
mm,
And I mean, when I talk about Luxembourg, there's a lot of work issues.
mm,
Because it's a finance center,
mm,
so there's
mhm,
lots
mhm,
of working. The
mhm,
people are
mhm,
mostly alone, and they just come to earn money, or they
mhm,
stay alone. They, especially during the pandemic, the social isolation was
mhm,
the issue.
mhm,
But for sure, every key event like divorce or
mhm,
losing a partner, or
mhm.
I have my cat here, so
No worries.
just one
Hello.
there. I don't know. Can you
So
see it?
cute. Hello. So cute.
Okay, so it could be many triggers, but as I see in Luxembourg, this is the main
Mhm.
problem with the working. And for example, mobbing is
Got it. Yeah. Yeah.
very often here in the companies, unfortunately. So I don't know, how is it in Spain? So there could be, when you go to a place with the cultural problems, like very religious place, so there could be very also different subjects.
Yeah, for sure. I know the divorce rate is high here in New York, or there was a time where single parenthood was a big statistic as well. And that's why therapy is now becoming encouraged. And like I said earlier, mental health discussions can be a taboo topic for most. I feel like there was a time where no one wanted to talk about, oh, I have anxiety or depression, because it's seen as a weakness. For certain cultures, for sure. Speaking for myself directly, like from what I know in the Asian culture, no one wants to hear about, oh, you're anxious, oh, you're depressed, oh, you need a mental health day. Those are very taboo topics. What do you think is the key for the world to start opening up to destigmatization and promoting the normalcy of mental health disorders?
I think it's already getting better compared to maybe
Before.
20 years ago. So already getting better. And I think here now, so as we are doing now a kind of conversation about it, we are informing people and just giving this attention to the mental health. I think we are just saying, okay, it's normal. It's also a kind of sickness. It doesn't mean you cannot see this, but you can still have depression, and you don't feel guilty when you are depressed, when you cannot do the things. So it's okay to have also mental health problems. And it's okay to seek help for it.
Yeah. I think a big part of it also is there are people who don't believe, right?
Yes.
That you're anxious, you're depressed. A lot of people dismiss topics like this by saying, oh, it's just in your brain. When technically it is, right? Physically, doc, like anatomically, is there data from like brain images or blood tests that we see that there is a difference between someone who is clinically depressed or clinically anxious versus one who is not?
I mean, there are some tests about measuring the serotonin. I mean, we are not using this daily report. So it's because it can also change, or some people have low serotonin and they are still not clinically depressed or anxious. So it changed. So we are not using it. It's more about a kind of when you just have your sessions, or when you talk with people, when you have anamnesis, you will see it. Actually.
Yeah, for sure. But as a psychiatrist, you obviously sit down with all of these patients, pouring out their life stories to you, which I can imagine some of them are very heartbreaking, would cause these mental health discussions with you, the psychiatric discussions. How do you not get affected by those stories? Or do you? How do you separate your own psyche from the person in front of you who's showering you with all of these pains and the fears and anxieties?
So, I mean, during our training, so we need to also, in the psychotherapy part, we need to have also our own therapy. So at least for 20 sessions. I think I had almost 200 sessions by myself.
Wow.
So it means you need to learn yourself best. And also we did also some supervisions with the professors to understand the situation. For sure, you're also, I mean, we are all humans, so we have feelings, we are empathic, but you need to set some boundaries and to protect yourself. So it's also important that you should be aware of your own issues. You should be aware of your own problems, and also not showing this also to your patient.
Yeah. Because I think there's also the possibility of you projecting your own emotions on the patient, right? Like, oh wait, I went through that already. I guess sometimes it's hard to be like, oh, this is what I did, versus of like, oh, this is what you should do or what we should do. I think that's why I don't know how it is again in other places, and this is why when you said that you were in Luxembourg and you were like, is that an issue? I was like, no, it's definitely not. Because I do want to see how different it is in different parts of the globe, right? Because all I've known is here in America. I grew up here. And a common thing between like nursing students or medical students are, they usually say, "Oh, I can't work in psychiatry. Oh, I can't work. I don't have what it takes to be in the
But
field
did you
of
work in
psychiatry."
psychiatry? Did you work in psychiatry?
No, well, I had clinical rotations back when I was in school, when I was in nursing school, and it's a very tough unit. It's a very tough field. That's why there's a lot of people who are saying, I know a lot of nurse friends and doctor friends is like, "Oh, I can't work in psychiatry. I don't have what it takes to work in psychiatry." As the expert in psychiatry, do you think there is something in a professional worker in the field of psychiatry that they possess? Is there a specific personality or whatnot that, oh, only these people are can work in psychiatry? Because it takes a lot of emotional toll on you too, right?
Yes, for sure, you need to be personally stable to
Yeah.
work in psychiatry. You cannot have your own issues
Yeah.
and you have problems, so it's
Hmm.
difficult for you to
Yeah.
concentrate on other people, especially in the clinics. So in the acute treatment, so it's more difficult. You have psychotic people, so
Yeah.
there are many people with anger problems,
Yeah.
so alcoholic problems. There are
Mhm.
many issues, and especially when you work in the clinics, it's more difficult in a
Yeah.
hospital.
Yeah.
So I would probably prefer. I mean, I prefer to work now by my
Yeah.
own.
Yeah.
But it's
Yeah.
more difficult in the hospital.
Yeah, because it's all mixed, right? Everything is going on. That's how I always said. I always tell my friends. One of my friends is a psychiatric nurse, and she's like, "Oh, you should come work with me in my psych unit." And I keep telling her, "If I work in your unit, I'm gonna be one of the patients by the by the end of the day." Honestly, I remember when I was in my psych rotations, we have our own patients, and you have patients with schizophrenia or personality disorders, suicidal ideations, or byproducts of suicide attempts. And it's sad, like you said earlier, Doc. It's so sad to know that while we see patients in the hospital or going to you and to other psychiatrists for help, there's a big amount of the population or who are not getting the help that they need,
Yes.
technically.
Or
Um,
they go too late, that it's already
go
kind of chronic problem.
That's why I was wanting to ask you too. Is there a time that's too late to ask for help?
I mean, if, for example, if you have a psychotic problem,
Hmm.
you don't go to the doctor for
Yeah.
getting help, and you have many episodes already,
Hmm.
and it's possible that you have still, I mean, you will have also still some problems for
Hmm.
all your life. So
Yeah.
it's important to getting help in this right time.
Yeah. Yeah.
And for
Sure.
depression, for sure, it's not only about that it could be chronic, it's also
Yeah.
dangerous. I mean, you know
Yeah.
that there are happening many suiciding,
Yeah.
self-harming, so there are many problems. It's many
Mm.
people are dying because of the
Yeah.
mental health issues.
Yeah. 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 For sure. When I was in high school, actually, I had periods of months where I was just generally anxious all the time. But during that time, I was too afraid to, seek help. Like, I really could not sleep. My mind would erase when I'm trying to sleep. And it's like there's always that black hole and like that deep feeling in your chest that you cannot explain. And I see that it's a prevalence in a lot of teenagers now. Do you think, like, for my generation or within my I'm 24 years old. So, do you think in my age group there is a prevalent factor for the rise in anxiety and depression? Do you think it's technology? Do you think it's social media? Do you think it's diet or cyberbullying? Do you think it's a mix of all of those?
I mean, also in my generation, there
Yeah,
were some problems.
yeah,
We
yeah,
didn't talk about it
yeah,
also.
yeah.
And
That's true.
so I think in every generation there
Yeah.
were some problems. Maybe we are more aware of mental health right
Mm,
now, and we are
mhm,
paying more attention to this and seeing
yeah,
more also the problems. But
yeah,
for sure, the medical technology changed, and it's also affecting our brains. And this change is too fast sometimes. So
mhm,
our bodies, our brains are still too slow for this change.
mhm,
So you just see the young person. So when this person like looking at the computer, playing games all the day, so
mhm,
it's a lot of a lot of distraction, also a lot of changing, a lot of triggers. So it's all affecting your brain.
Yeah, I
For sure.
agree.
It's isolation. So
Yeah, yeah, yeah,
and you're just with your smartphone or
yeah. The whole day, right?
and all the day. And I
Mm-hmm.
think we were still younger, older generation was still a little bit more likely to have more social contacts.
Mm-hmm. I agree. I agree with that completely. I feel like even kids now, they're like on their phone all the time, right? And the content of what's on their phone, right? We have ideal beauty standards that may lead to body dysmorphia, right? And we see even events of anorexia and bulimia in many young people. In my survey, I asked, like, what's your greatest fear? And I was alluding this to people have different phobias. You have agoraphobia, you have arachnophobia. There's just phobias of every kind. But the answers that I received were actually not specific objects or specific things or places. They were very vague and complex answers. And a few of them were, I'm afraid of death, or I'm afraid of losing my loved one. And one of them was, I think it was too long for them to write, so they divided it into into answers. They said, I'm afraid that I will lose control, and I don't know what will happen to me when that happens.
Mm.
Um, and there are many people who feel that way all around the world, and they don't want to tell anyone, obviously. Because there is a stigma still. No matter how open it is now, there is still a stigma and the fear of being called, oh, you're crazy. Oh, you're weak. As a psychiatrist, how do we tackle that? You know, especially in that periods of panic, are there techniques and strategies to ground yourself in that moment?
Yes, for sure. We have some grounding techniques and some relaxation techniques that we can use
Mhm,
at the moment, because it could be a kind of positive distraction that you can use, or something
mhm,
that you like,
mhm,
or I mean, giving, as I said, there are some techniques that you can learn during the
mhm,
therapy, but
yeah,
sometimes it's important to find out, okay, what's this person like, what this person like,
yeah,
or personally loves,
yeah,
and I think it's important
yeah,
to know it individually.
yeah, yeah. Thank you. I'm so sorry, by the way, that all my questions are so long.
I
That
think
that
I'm nice. It's nice to hear, and I
yeah.
talk about it, so it's no
Yeah,
worries.
psychiatry and mental health is such a big topic here, and it's one that's personally dear to me because I do have a lot of friends. Also, I have a friend who died by suicide years ago, who I went to high school with, and it's a very prevalent issue. And a big issue here too is physician suicide, mostly amongst residents who are in training. People feel stuck, and I think also with all of the news that's going on in the world, right? Add in like natural disasters or whatnot. I know there was like a fire in Turkey just a month or more than a month ago. And all of these news can bring so much bearing to people's emotions, even if you're not from that country or even if you don't have family in that country. Just reading news like these. Do you think people should avoid reading horrific news like these to protect themselves, or is some acute stress important for the body as well?
I think, I mean, for example, during the pandemic,
Mm,
so it was recommending to people not reading too much, not this
mm,
overstimulating,
mhm.
because it was also a lot of wrong information.
Yeah, yeah,
The information was changing all the time.
yeah,
Too much.
yeah,
So for sure, we need to look for news. But if, I mean, when you just watch the news all day, so it's possible that you can also get traumatized by
yeah,
reading or hearing the things.
yeah,
It's
yeah,
possible. So it's important to avoid some part, but
mhm,
not everything.
yeah,
And we need to just protect ourselves and not just
yeah,
concentrating the negative things in
yeah,
our out of our lives on the
yeah,
all places that, I mean,
yeah,
time the bad things are happening, but there are also nice things happening
yeah,
there.
yeah, yeah. And that's like a form of decompression, right? Finding things outside the bed and focusing on them. And like I said earlier, as a psychiatrist, you hear the you hear the worst things ever, the most heartbreaking things ever. How are the ways that I know that you also had therapy for yourself throughout training, but now, after a long day at work and you've heard all of these stuff, how do you separate yourself from work? Do you have like a hobby or whatnot that separates you from work mentally?
I don't know. So it's difficult. Sometimes when I have a lot of things, I mean, I hear also very sad
Mhm.
stories,
Yeah.
and but it's too much. So I don't want to hear anything the
Mm,
rest of the day. But it's not
mm, mm.
possible. So
Yeah.
I have children, so
Yeah.
I come home. So
Mhm.
it's maybe it's now more automatically that I just
Cut
change.
it out. Right.
But it's possible that it's sometimes too much, and I need to relax. And I like to, for example, I like traveling. And
Yes, I know.
I,
Yeah.
for example, at the weekends we are going somewhere else, and I just try to spend my time, the rest of the time, positively,
Yeah.
and giving the attention to the positive things that I like.
It's
It's,
amazing. Yeah. Which I feel is so important also for everybody is to have a life outside of work, right?
so this work-life balance, I think it's
Yeah.
important for everyone, right?
Yeah. And we do see people who do not have that, right? And it leads to very, very dangerous results, whether physically they're overworked or mentally and emotionally. And just one common question actually that I received from the DMs when I started promoting our post is when is the time to switch from just going to therapy to actually seeing a psychiatrist?
You mean a therapy as a psychologist or what?
Yeah. Yeah.
Okay. I mean, there are some people, they are also coming directly to me, for example.
Hmm. Hmm.
I'm also psychotherapist.
Hmm.
So I don't know how it is in the US. I think there are
Yeah.
more psychologists, they are for first step. So, and normally the psychologists, when they are in the therapy, they are saying also their
Yeah.
clients that it's
Yeah.
time to see also psychiatrists.
Yeah.
And they see, okay, there is some dangerous situations or
Yeah. Yeah.
medication. So normally, most of the psychologists are working also together with the psychiatrist.
Yeah. Yeah. Yeah.
There are for sure some they don't believe in the medication, but I think there are most of the colleagues they are working together. So
Yeah.
I think it could be helpful to keep in touch,
Yeah.
and
Yeah.
as I said, sometimes the people can also come directly to psychiatrists.
Yeah. I agree. And basically, what I'm getting from this whole conversation is to not be afraid of a psychiatrist. Because I think, at least for here, there is a certain, I don't know if fear is even the right word. I think it's more of like an easiness, or people are afraid to be judged by others, right? What is your message as a psychiatrist to someone right now who's going through such a hard and heartbreaking and traumatic period, time, season in their life?
I think nobody, the people, or you shouldn't manage everything alone. I think
Mhm.
it's not a big issue to seek for help.
Yeah,
First, at least talking with a friend could be the first step.
yeah, that's true. Mhm.
And then if there's need, so there is no, I mean, we are all human, we are all, yeah, we have also our problems, so it's
Mhm.
not, the life is not always happy, and it's normal to feel sad
Yeah,
sometimes. There are good days and bad days,
yeah.
and for now it's a difficult time now, it doesn't mean it will stay like this. So
Yeah,
this is
that,
something that I say, but there are probably many things to say.
yeah, yeah. No, no, no. I agree, Doug. You're right. You're completely right. Like, right, we always see those inspirational posts on Instagram. It's just a bad day. It's a bad week, bad month, bad year, but it's not a bad life, right? Um, Doc, it was I've learned so much today, and I feel even more encouraged than ever. And thank you so much for all that you do. It's such an integral and imperative line of work that you do. Like you said, we are all humans. I think there's some who believe that they're superhumans, but
For sure.
yeah, only to find out, in the end, that we all have our own weaknesses and our flaws and scary stories in life, right? And heartbreaks. But thank you for being that vessel
Well,
and for the world to be comfortable and to be more open with yourself and to remind everyone that, right, no man or no woman is an island, right? Doc, thank you so much. I had so much fun talking to you tonight. I keep saying today, but it's tonight for you. I don't want to keep you for too long because I know it's late there. If you want to say a closing statement to everybody.
I wanted to also give a feedback. I like your videos, so I think it's.
Thanks so much.
I watched also the other one, so I think it's a super work. So I want to also thank you for this.
Thank you, Doc.
Thank you.
I hope you have a great night. This will not be the last time that we will talk because I know there's
for sure.
There's a lot of people who still needs to hear this message time and time and time again. All of these reminders that it's okay not to be okay, right?
Yeah.
So, Dr. Cigdem, thank you so much. Have a good night there in Luxembourg. Stay safe. Yes, thank you. Bye. Thank you everyone for watching. Bye.